See, diabetes is a chronic condition which affects the body in processing the blood glucose. So, whatever the normal amount of glucose, whatever the amount of glucose we obtain from our diet through carbohydrate or from other sources, so that gets metabolized and to up to a normal level. But whenever there is a dysfunction, like for example in type 2 diabetes, where there is a insulin resistance is there, where the insulin is a hormone which cannot act properly. So the blood glucose does not get metabolized and it builds up in the blood to any extent, up to any extent, depending upon the degree of the diabetes, the degree of the insulin resistance. So when the blood sugar goes beyond the normal range, it gets affecting various organs, and because of that, these diabetic patient various symptoms and signs and various complications because of the diabetes. So there are like many types of diabetes. Type 1 diabetes where the insulin is not properly secreted by the organ called pancreas, and type 2 where because of the obesity, sedentary lifestyle, there is a excessive amount of fat deposited in the belly, and which is a very stubborn fat. It's the adipose tissue. So this stubborn fat hinders the insulin action, and that's why the blood glucose levels increases. And other autoimmune diabetes also. In pregnant females, we can get a gestational diabetes because the placenta secretes hormones which again interfere with the action of insulin. So that is known as gestational diabetes, which occurs in pregnancy. And why should we worry? Like say because the diabetes carries a lot of complications. If in untreated, undiagnosed on time, this will lead to complication right starting from head to toe. Like it affects our eyes, retina. This is leading to retinopathy. It interferes with our vision by like a premature cataracts. Then it affects our gums. If you see the gums, poor dental hygiene, again infections. Then if you go below the heart, because of the various heart vessels are affected, that they can lead to early myocardial infarction, heart attacks at a young age. And because there is like autonomic affection, the autonomic system is affected. Patient might feel giddy, if they get up from sleep, like sitting position, if they get up early, they feel giddy because of the autonomic system is affected, inappropriate sweating, and if we go below, then the liver is affected. The liver fat lipids start accumulating in the liver, leading to fatty liver, which is again non-alcoholic steatohepatitis hepatitis like NASH, NASH, NASH. And this liver does not work effectively, leads to indigestion. Sometimes the stomach is affected. There's a delayed emptying. The food is accumulated inside, leading to bloating sensation, and patient complain of early satiety, bloated abdomen. So there is a condition known as diabetic gastroparesis. If we come below, then the pancreas is affected. If we go below, this kidneys are affected. So the kidney dysfunction and lead to chronic kidney disease. The patients will requiring dialysis for survival. If we go below, the like sexual dysfunction like occurs like in form of erectile dysfunction, premature ejaculation, and this leads to lot of humiliation and affection and depressive symptoms in male patients. Then if we go below, then the blood vessels in the lower limbs are affected. In this patient can get diabetic foot, gangrenes. So diabetes in terms it can affect any part of the body, and that's why we should be more worried about that. See, diabetes is not only a sugar like a levels. See, however, normalization of sugar level as per the American Diabetic Association, the recommendations are important because of that we can know that the sugars are adequately controlled. But it is not only limited to the levels only, because we it's a long-standing disease and we need to educate and the patients and ask them to evaluate for the early complications so that we can minimize the cardiovascular and the other long-term risk factors. So, and the major complication of diabetes, if we say, it's like there are complications which can happen like acutely in a short period of time. It's like hypoglycemia if the sugars are, the patient has not eaten and has taken the medicine and the sugars level go down. Then this is a very like a critical condition, hypoglycemia. It is known as hypoglycemia, where patients can have various symptoms like from sweating, palpitations, confusional state, or the body becomes cold, clammy, extremities, BP goes down, and the patient is confused. And if proper like sugars are not corrected, then patient can lead to permanent brain damage, can through convulsions also. So this is the lower end. The sugars goes below up to like less than 60 milligram per deciliter. So this is an emergency in which patients should be diagnosed immediately and should be supplemented with the glucose. But if this is the another end where the sugars go high, there are two conditions like diabetic ketoacidosis, which in which the sugar level are high and the insulin is not secreted to that extent to metabolize the raised sugar level. So the lipids, the cholesterol, they start metabolizing and leads to ketone formation, and these ketones are excreted through urine, and there is a condition like the acid level increases. This leads to diabetes ketoacidosis. The patients like breathe very rapidly. There is a fruity smell from the breath, and and there is like a lot of dehydration in the body because of the high sugar level. The patient's sugar is also on the higher side. There is a dehydration. The ketones level are the high. The patient is rapid, shallow breathing is there. So there's emergency complication in which we have to control the sugar. We have to hydrate the patient, and it takes and some precipitating factor is usually there for the prescribed diabetic ketoacidosis, like skipping of insulin dose, skipping of medication, or any infection in the body, or infection has precipitated the diabetic ketoacidosis. So we need to tackle those infection as well, along with the control of sugar with the insulin. Like we give insulin in a drip to control the sugar level, and we have to hydrate these patients. So it takes like a time the ketones to become negative and the dehydration to be corrected, the infection to get controlled, the sugars. We cannot bring down the sugar immediately because otherwise there will be many metabolic parameter changes will happen, electrolyte imbalance will happen in the body. So we need to take care of all these parameters to control the sugar level. And there is another condition, non-ketotic hyperglycemia, in which this is a condition in which the ketones level will not be there in the urine, but the sugar level will go above 600 milligram deciliter, and there will be a lot of edema around the brain, and the patient sometimes can throw convulsions, or various type of convulsions can happen, various types of involuntary movements can happen in the body, with the body, which sometimes the patient feels it is patient has got a convulsion disorder, seizure disorder, or something like this. But these atypical involuntary movements can happen in any part of the body, and the patient will be comatose, will be in deep coma, and will be confused in various stages of this neuronal affection. So depending on that, again, the management would remain the same. There will be like control of sugars through insulin drip. We have to see for the electrolytes if there are any changes. We have to hydrate the patient, and the frequent monitoring of blood glucose uh, every half hourly, 1 hourly, depending on the situation of the patient, depending on the blood sugar level the patient is having. Along with this, there is a chronic complications. Chronic means long-term complication in which the sugars are uncontrolled. This affects the minimal vessels and the major vessels, minor vessels and the major blood vessels. So this vessels affection can lead to stroke. This blood vessel affections, stroke can happen because of the premature atherosclerosis. This atherosclerosis is a condition in which the blood vessels get affected. There is excess of fat deposition in the vessel, leading to decrease in the diameter of the blood vessel wall. There will be a diminished flow to the organs, and this patient can develop stroke. Then this patient can develop myocardial infarction, heart attack, because if the blood vessel of the hearts are affected, this patient can develop myocardial infarction. And the blood vessels of the kidneys are affected, the kidney dysfunction will happen. If the small vessels are affected, this will lead to gangrenous changes in the lower limb, or there will be neuronal affection, the nerve damage will happen. This nerve damage will lead to peripheral neuropathy like tingling sensation, or sometimes burning feet sensation, or numbness. Various presentations can happen because of this uncontrolled sugar, long standing uncontrolled sugar. And that's why we recommend strict sugar control, not only with the fasting and post lunch, we need to check the glycosylated hemoglobin, which is known as HbA1c. The HbA1c is a glycosylated hemoglobin which helps in the diagnosis of diabetes. Also, it helps in evaluating the adequate sugar control, whether the patient therapy, whatever we have initiated, with that therapy, his sugars are controlled or not. Because the target glycosylated hemoglobin when the patient is on therapy should be less than 7%. So that says that the sugars are adequately controlled and the chances of developing further complications are less. But if, for diagnosing diabetes, the HbA1c should be more than 6.5. If it is 5.8 to 6.4, that says the patient is a pre-diabetic, not a diabetic, but it's a pre-diabetic, and such patient has got the time to rectify their diets, right? To need to put stress on their like take actions, preventive actions, like they can initiate exercises, they can restrict carbohydrate consumption, they can take preventive measures to progress to stop them progressing into a diabetic state. Uh, so HbA1c. So overall, diabetes it's not only a number game, but it has like patient is a long-standing disease where the patient himself has to understand the disease, has to understand the importance of self-monitoring of blood glucose, has to understand to be educated about this disease, and they can evaluate for the complications so that further cardiovascular long-term risk factors and the damage can be prevented.